Welcome everyone to this webinar brought to you by PHO and CIPHI. Participants will remain in lecture mode for the duration of the call. If you have any questions, please send them through the chat pod located at the bottom of the right of the screen. I'd like to remind attendees to put in the chat box what health unit they're from and how many participants are joining with them in the group. I'd like to start by introducing everybody. So today's session is NRC and Health Canada Reducing Radon Ingress in Canadian Homes. Our presenters are Jeff White, Dr. Leanne Grace Zhao, and Kelly Bush. Jeff White earned his Master's of Science in Analytical Chemistry from Queen's University and has over 30 years experience in chemical and radiochemical research in the private and public sectors. He ran the Science of Health Canada's National Radon Program from 2007 to 2018. He contributed to radon provisions for the 2010 National Building Code and is the chair of the Technical Committee for CDSB 14911 and 14912, National Radon Mitigation Standards. He currently supports radon research at National Research Council Construction Research Center, is chair of the Canadian Committee on Indoor Air Quality in Buildings, and contributes to International Atomic Energy Agency radon guidance documents. Dr. Leanne Grace Zhao earned her doctorate in building engineering at Concordia University and joined the National Research Council of Canada as a research officer in 2008. Grace has led her team in developing Canada's first and two of the world's first radon test facilities, in addition to completing product validations to control radon in buildings. She's currently leading a team undertaking a field study of passive radon stacks in homes across Canada. Her other research areas include the impact of mechanical systems on indoor environment, building energy performance, computational fluid dynamics, and whole building simulation, as well as depressurization in dwellings. Kelly Bush has been the manager of the National Radon Outreach Program since 2008 at Health Canada's Radiation Protection Bureau. Prior to joining Health Canada, Kelly worked in the private sector as a marketing and sales management professional. With over 20 years of senior management and leadership experience, she has a strong acumen for converting ideas into plans and ensuring their successful execution. Kelly holds a Bachelor of Commerce with honors in marketing from Concordia University. At this point, I'd like to pass it off to Jeff White to begin our session.
Okay, thanks very much, Paresh. Can everyone hear me? Hopefully you can, and we could hear earlier, so hopefully nothing has changed. So we have a lot of ground to cover today. There's 3 speakers. I will be doing the first few slides, and I'm going to hand it over to Kelly for a while, and it's going to go bounce back and forth. So without further ado, just a couple of slides on ionizing radiation. So particularly from the radon standpoint, radon and its daughters are alpha-emitting radionuclides, and those impart a huge amount of energy over a very short distance, so they're very damaging, particularly to cellular DNA. Here's a slide that sort of gives you a flow chart for ionizing radiation and how it can damage DNA in the cell. So this is going on constantly all of the time. Much of the time, DNA is able to repair itself, and if it does, there's no effects. When you get into problems is when you get misrepair of DNA, and particularly DNA double-strand breaks are the most problematical from an ionizing radiation standpoint. Those are the ones that don't tend to get fixed properly, and they can lead to random stochastic effects. And for ionizing radiation, the biggest stochastic effect is cancer induction. And then if you get into super high dose rates, you tend to get into cell death. And of course, for the human, the lethal dose is about 5 sieverts on average. This next slide is just a primer, and I'm sure most of the people out there in risk management know a lot of these models. And I've just got 3 of them on here. Of course, one of them is the classic threshold model, where you don't have any effects until you reach a certain minimum level, and then you start to get health effects. The middle one on the graph is hormesis, and it's someone who's worked in radiation for many, many years. I'm hoping that's the one that applies, but I'm quite skeptical, unfortunately. And that one tells you that there's an actual protective effect to a certain degree with ionizing radiation, and then you start to get health effects. But the universally accepted threshold dose model, or dose response model, is the linear no threshold, and that's a straight line through the origin. There is some uncertainty in the LNT down at very low doses, but the scientific community generally accepts the linear no threshold model for radiation-induced health effects. Two slides here on the history of radon before I hand it over to Kelly for her next part of the presentation. And this is kind of how we've gotten to today over the last more or less 100 years or so. So way back in the 1500s, in a particular region of Europe, the Urs Mountains, which is a mountain range that separates Germany from the Czech Republic, metal miners were getting extremely high mortality from respiratory diseases. And it was called mountain sickness, among other names. And it wasn't uncommon for wives to have 6 or 7 husbands during their life, because they would just all die in a very short period of time, like over a number of years. Fast forward to 1838, when German pathologist Johann Müller discovers lung cancer as a disease. A couple of decades later, lung cancers are found in autopsies of these European miners. 1896, the famous Henri Becquerel discovers radioactivity. And a couple of years later, the Curies discover radium, which is the immediate parent of radon-222. And then a German chemist named Frederick Dorn in 1900 discovers radon, the gas, naturally occurring when, not surprisingly, studying the radium decay chain. In 1924, it's hypothesized that radon could be a cause of lung cancer in miners from the Czech Republic, again, where miners had a very high incidence of lung cancer, and the measured radon levels in these mines were very, very high. As the 20th century goes along, by the 1950s, it's recognized that radon causes lung cancer in underground miners. Fast forward a little bit to 1984 in Pennsylvania. This is a very famous story. I know some people might already know. And a gentleman named Stanley Watrous, who was a nuclear engineer, he was walking into a newly built nuclear plant. And this is before the plant has gone critical. There are no nuclear reactions going on in a core right now. He sets off the portal detectors walking into the nuclear plant. And of course, all the radiation safety professionals start scratching their heads. Long story short, they find that the source of this radioactivity all over him is coming from his home, which was sitting at something around 100,000 becquerels per cubic meter. The U.S. EPA very quickly adopts a radon guideline at that point of 148 becquerels per cubic meter. By 1988, radon is classed as a human carcinogen, class 1A, top of the heap by the IARC folks. And Health Canada promulgates the first Canadian radon guideline at 800 becquerels per cubic meter. There was no scientific program associated with this. This was just a radon guideline. In the 90s, researchers start to report lung cancer studies from residential radon exposure. 1998, the FAIR-6 report comes out. And in the early 2000s, a number of famous epidemiologists start pooling results from residential radon exposure studies. And it's recognized that radon at levels in homes is the cause of lung cancer. And in June 2007, we at Health Canada adopt a new radon guideline of 200 becquerels per cubic meter after a several-year consultation program. And we also, at this point, roll out the National Radon Program, which is a funded program this time around. And for those who may not know, the SI unit for radioactive decay is the becquerel. 1 becquerel is 1 radioactive disintegration per second. And at this point, I will hand the baton over to my colleague, Kelly.
Thanks very much, Jeff. Hello, everyone. Thanks for joining us today, and for many of you taking your time over lunch. It's much appreciated. I'm seeing some of the names. I see a fair number of familiar names, and some of what you're about to hear from me is you may be familiar with, but I think it's important and it bears repeating. So we'll start with our radon map. And so many of our stakeholder partners and the public over the last 10 years since the program began, the National Radon Program, have been asking for a radon map. And our message during that time has been consistent. All homes have radon in them. The only way to know if you have high levels is to test. And when we spoke with other countries that had existing radon programs, often we were cautioned not to put a map out because what they experienced were that if people weren't in the red zone, the high risk area, they just figured they didn't have an issue, and it actually promoted less action. So we were really cautioned against coming out with a map. So it's really important that knowing if you live in an area that is high or low risk should not influence the decision to test. That being said, we think it's valuable to have some sort of visual tool that helps you understand the risk, especially public health and jurisdictional authorities. So we recently developed an interactive radon risk map using our national radon survey data, and it provides you with the percentage of homes with high radon by health region as you scroll over it. And so you can see this map at canada.ca/radon, and you'll see that right there is a radon map button. But I really want to reiterate this should not be used as a radon testing decision-making tool. All homes need to be tested, but it may be useful to help public health prioritize resources from a program perspective. So what are the health risks of radon? Radon is a leading cause of lung cancer in non-smokers. We estimate that over 3,000 lung cancer deaths each year are radon-induced, and it's the only known health effects associated with long-term exposure. Smokers also exposed to high levels of radon have a significantly increased risk of developing lung cancer. And really, the story of radon from a health perspective is it's preventable. That there are actions that can be taken to reduce exposure and reduce your risk of lung cancer. So what you see up on the screen now is actually a newer table, and if you've ever participated in any of my previous slides, we had a different bar chart, but we've updated that. But it really, we speak to sort of two types of groups of people who know about radon, who have heard of it, are aware of it, and want to do something about it, and they're coming to us asking us how to test, or if they've tested, what to do to reduce their levels. But there is a very big portion of the Canadian population that doesn't know about radon or isn't worried about it. And so the purpose of this type of exposure risk comparison is to help people compare it to things that they understand better. So you can see that this chart compares the risk of dying of radon-induced lung cancer to other better-known risks like car accidents, carbon monoxide, and house fires. And really the communication is if you're doing something about those things, then you should also be testing for radon. So testing, how can you test? There's two options. It's really simple. And that's the important message is, again, coming back to this whole concept of prevention. It's letting people know what it is and what the health impact is, and that they can do something about it. So from a testing perspective, two options. You can hire a certified radon measurement professional, or you can purchase a do-it-yourself test kit. If you purchase a do-it-yourself test kit, you're likely spending somewhere in the range of $40 to $60. You hire someone to do it for you, you're going to pay more. It's a service that you're paying for. Health Canada recommends that you test during the fall-winter timeframe, and that you use a long-term test for a minimum of 3 months. There are short-term tests available on the market, but the risk with those, and Jeff will talk a little bit about this in a minute, is the risk of false negatives and positives. The easiest thing to do if people are asking you how to test or where they can go to test, and actually I should have updated the slide, is just tell them to go to takeactiononradon.ca. And right from that website, there is a button to purchase a test kit or hire a certified professional. The other message that's really important, because we often hear this, and when we're engaging the public and other stakeholders, is, okay, great, I don't want to test. I don't want to know, because I won't be able to do anything about it, or it's going to be really hard to deal with it. And that's absolutely not the case. So radon reduction, reducing the amount of radon in your home is easy. Techniques to lower radon levels are effective and can save lives. Radon levels in most homes can be reduced by more than 80%. What you're seeing up on the screen here is just one piece of an infographic that we have that provides the results of a mitigation action follow-up survey that we did, where many of you know that we've done extensive large cross-Canada surveys. So we went back to those homes that tested high and we said, so what did you do about it? Did you do anything? And if you did do something about it, we offered to retest. And so what you're seeing as far as the 90% reduction when you hire a certified professional are the results of those surveys. So this is data that we've collected, and evidence that it does work, and evidence that telling people they can hire a certified professional and they can help them reduce the radon level in their home is a fact. Often we hear people talking about wanting to just take simple steps like sealing cracks, which is not as simple as anyone thinks. It actually takes a lot of work and isn't a viable standalone solution, as you can see with the results at 13%. So Health Canada has led a national radon program since 2008, and it consists of 5 main components: characterizing the extent of the radon problem in Canada through measurement and mapping, technical projects to develop and validate guidance and technologies for radon risk reduction, and to transfer that knowledge to industry and to other jurisdictional authorities, research to better understand how radon leads to lung cancer, encouraging adoption of radon risk management practices in relevant policy and legislation, and finally, number 5, delivering a radon education and public awareness strategy to inform Canadians on radon risks and encourage action, testing, and remediation to reduce those risks. So we've done a lot of work under the National Radon Program, but I just wanted to highlight some of the key things that we've done. You know, the first thing we did is walk the talk, because we started our program and we had a lot of resistance from people about coming out with this message that everyone needed to test. So we wanted to demonstrate that we felt this was important by testing federal buildings across the country. And that federal building testing program has recently closed or ended, but we tested over 21,000 buildings. We've done cross-Canada surveys to get a better understanding of radon levels across the country, and I mentioned earlier the map that we have. Jeff mentioned earlier that he was involved in the changes that were made in the 2010 National Building Codes, and we're working towards having some additional changes made in the future. One thing that was really important to us, because we were going out to Canadians and saying, do this, test, reduce, we need to make sure they could do something about it and that there were quality services and products available for them to do something about it. So the development of a Canadian National Radon Proficiency Program, a certification program, CNRP, was really important. Now, this is not a Health Canada program. It's led by another organization, but we work with them, and they make sure to follow our guidance and incorporate our research and our messaging into what they do as well. More recently, the development of the national standards for radon in new and existing construction with the Canadian General Standards Board. Jeff, I think, tells you about that and is an expert in that. He was very involved. And then extensive research on testing mitigation techniques. So when we put out this guidance, we want to make sure we're giving good guidance to people. And we want to make sure when they go to do it that it's going to be feasible for them to do and that it's going to have the result that we're telling it it's going to have. So we've done the research to make sure we're confident in that messaging that we're giving to Canadians. And then this is a challenging issue to get people to pay attention to. It takes a lot of repetition for people to actually hear, oh, radon, it's this. Oh, I should do something about it. You might have told them 5 or 6 times prior over a 1, 2, 3 year period, and then they actually hear the message and take action. So there is a need for an education program that's repetitive, and there is a need for help from authorities with a credible voice like yourself to get that message out there. So most recently, we have implemented a radon outreach contribution program. It's a one-step directed solicitation process. and we communicate directly with potential applicants to invite them to submit proposals. It's a limited budget, so we can only do so much each year with that. But the potential applicants do absolutely include public health authorities and public health units. Funded projects include radon awareness and behavior change, advocacy to promote regulation, policy, or program changes, all in an effort to reduce indoor radon exposure for at-risk populations. And I just highlighted that we actually do currently have 2 contribution agreements with Ontario Public Health recipients. And I'm happy if you're interested in talking to me more about that offline. I think many of you have my email address. If not, I'm sure it'll be shared. So happy to talk to you about that. So key to radon outreach and education efforts has been the development and trial and then expansion of many different types of targeted programs. So over the last 10 years, we've tried many different radon outreach approaches and pilot projects across the country to raise awareness and promote action. Some were effective over time, and then we expanded on them. Others were not. So what you see on the screen are some of the targeted projects and programs that have had significant impact, such as educating health professionals, the energy efficiency audit programs, engaging workplaces, collaboration with real estate and child care associations, establishing radon mitigation standards in community testing. One of the ones that's growing at a really fast pace most recently is library testing lending programs. So, and that for me is great as well for the National Radon Program as well, because we've really struggled in how to make radon testing more accessible, let alone mitigation, and that's one we're still trying to figure out, but more accessible for people below the poverty line, for example. Also included in there, you'll see we've been updating and sort of rebranding our materials. So, you know, for example, for those of you that have been working with the National Radon Program for a while, we used to have a pamphlet that was titled Radon Gas. Now I even forget what it's called. Is it in your home? I think it was a question mark. And now we've changed that to radon gas, it's in your home, making a much more clear statement because it's not a question as to whether or not it is or isn't. So critical to raising awareness and most importantly for us influencing radon reduction action is the development of more grassroots efforts, getting all of the relevant jurisdictional authorities raising their voice on radon. So what you see on the screen here is radon engagement and action at the provincial, territorial, and municipal level. The approach to taking action varies across different levels of governments and jurisdictional authorities across the country. In some cases, it's big steps, big actions that have been taken, and in others, it's smaller, more targeted. But all of them are important, and all of them are resulting in progress, momentum, and an increase in awareness and a reduction in indoor radon levels. So some examples of those that I think are really relevant, obviously, to you, and one of the reasons that I think we now have a couple of public health units that are taking advantage of our contribution program is the Ontario 2018 Public Health Standard that was changed to include radon, the Ontario Territorial warranty that covers radon mitigation. Also, other good examples are the BC building codes where they've gone well beyond the standard building code for radon and require a passive stack in at-risk regions. Yukon mandated daycare testing. Alberta has evict radon and a bill pending. Whether or not it'll make it through, who knows, but it's the fact that they're taking action is incredible. School testing, real estate engagement, and training in many provinces. There's the Saskatchewan Take Action on Radon Coalition, and I don't know if any of you have seen. If you haven't, I encourage you to take a look at Saskatchewan Lung Association's Facebook page. They recently posted a story of a young mom who was diagnosed with lung cancer, and they believe it's radon-induced, and telling her story. So lots of amazing things going on across the country. So 2020 and beyond, our priorities are updating the building codes to reduce radon in new construction. In a perfect world, that would be the requirement of a passive stack and maybe even testing. Radon mapping and spatial analysis is to better define at-risk regions and populations across Canada. The work we're doing in that area is to develop resources that are relevant to jurisdictional authorities so that when they say, yes, we want to take action on radon, but we need a better understanding of what the issue is in our own community, we can help them do that. We've also hired an epidemiologist in the last year for radon health economic analysis. So we're looking at practical radon interventions, measured in qualities or quality-adjusted life years. We're updating the Federal Radon Action Plan to engage other relevant departments in a more formal way. And we're creating Radon Action Plan toolkits, so sort of a turnkey resource that provinces, territories, and municipalities can use to develop their own customized Radon Action Plan. So we're just in the first part of that. We hope to start piloting it in the next 6 months or so, those toolkits. And also to really try and affect behavior change. So it's one thing to see that more Canadians know what radon is, but it's a much bigger challenge to get them to do something about it. So we're doing some radon behavior change research piloting, working with a behavioral scientist to try and find the best way to deliver our outreach programs so that we are getting people to actually take action. So I think I will stop there and pass it back over to Jeff. So thank you.
Okay, thanks a lot, Kelly. So now we're going to talk in a few minutes. Grace's going to concentrate on a lot of the building science stuff related to radon. But I just thought I'd throw up this slide because this is a classic one. You can see on the right our lovely diagram that we steal from NRC, and it has been around since I've been running radon stuff. And it's very nice because it shows you all the potential entry points for radon to get into a building. And there's many, of course. You've got cracks in the foundation, both in the wall and in the concrete floor slab. You've got sump pits. They're a favorite one. Sometimes weeping tile can find a way in for radon. There's many different entry routes. And in the middle, you see the one that I always like, and Kelly's group came up with this years ago, but really, fundamentally, the air pressure inside a house is normally lower than that in the underlying soil around the foundation. So in effect, your house is always sucking on the soil around it. So of course, if you have any entry points, this negative pressure regime tends to suck the radon into your house. And of course, it can build up to very high levels. One thing I will just briefly mention, I don't know if anyone noticed this, in the graphic on the top right, you see a shower there. And radon in well water can sometimes exist at very high levels. And so when water comes into a home, such as in showering or laundry, etc., it will outgas from the water into the air. And that generally is not a significant source of indoor air radon, but in exceptional cases, it can be. So I just mentioned that in passing. Okay, why long-term testing? Kelly has alluded to this, and we've seen this over the 10, 12 years I've been working in radon, and Grace and I continue to see it all the time in the research that we do. Radon levels fluctuate. It's not uncommon to see 20 times difference between low radon levels and high radon levels. So if you happen to test your home for 2 days and you're in a couple of good radon days, you could be fooling yourself. And conversely, if you're in a bad couple of radon days, you could also be fooling yourself. So false positives and false negatives are fairly significant from short-term testing. So that's why you should never base a radon mitigation decision on the results of a short-term test. So that's just sort of to reiterate what Kelly mentioned earlier, because we see this all the time. This slide just alludes to the most effective method for reducing indoor radon levels, and that's active soil depressurization. And that graphic that you see has sort of two cases. The left-hand part of it is sort of what we like to call a Canadian solution, where the radon mitigation fan is mounted typically in the basement, and we do what's called a sidewall or rim joist discharge. The graphic on the right is the sort of US EPA solution, where the fan is installed in the attic and the radon is discharged above the roof line. We found some particular advantages to the sidewall discharge, particularly in Canadian weather. We have some pretty brutal winters, as everyone knows, and there are some significant problems with icing and such when you do above roof discharge scenarios. But as Kelly alluded to, high radon levels can be easily fixed. And we find with ASD, it's typically well above 90% radon reductions we get from it. And we also always recommend senior certified mitigators. Some people who are very qualified can install their own ASD systems, but it's sort of, don't try this at home, kids, is what I usually say. And it's not that expensive. And as a matter of fact, in new construction now, ASD installs are coming down around the $1,800 mark. In retrofitting in existing homes, they're up around $2,500 to $3,000, depending on the complexity of them. This slide could be a whole lecture unto itself. Kelly alluded to this a little earlier. We're starting to get into some of the health economic benefits associated with radon mitigation. So this is a project that I was involved with Ottawa U for about the last 3 years or so with Dr. Janet Gaskin. So we're working on the 4th paper right now. The first one was kind of a global estimate of lung cancer mortality. So we looked at indoor radon data from 66 countries worldwide using sort of the big risk models, the sort of BEAR-6 radon risk model. And we actually used a couple. But in terms of the sort of worldwide radon, average radon lung cancer risk, it's in the 14 to 16% range, which is really good convergence to what we actually found in Canada. The second paper was looking at some interventions in new construction and quality-adjusted life years and in different parts of the country. From a provincial territorial standpoint, it was found that the Yukon was estimated to benefit the most from these particular interventions in new construction. Paper 3 was interesting because it looked at radon mitigation in both existing and new construction. And it's a really interesting one because it follows about a 100-year time horizon, and it's got a lot of very sophisticated computation associated with it, following people at 5-year intervals through their entire life and as they move to different parts of the country. We looked at basically different radon thresholds, 200, 100, and 50 becquerels per cubic meter. And as I say, we looked at it in different parts of Canada, both provincial, territorial, and at the census metropolitan area. And that paper used the Markov cohort model, which is commonly used in a lot of health economic analysis. And the 4th paper that we're working on right now is looking at incremental cost efficiency effectiveness ratios, ICERs as they're called, for mitigating existing housing using 2 types of methods of computation, both the Markov cohort and a discrete event microsimulation, which follows at the person level, and it's very sophisticated and very computational intensive. And that new paper uses 2016 Canadian population data. So again, those are interesting papers for those of you who are interested in that area. Just some summary from the work that Janet has done. So of course, as Kelly alluded to, radon is an important but extremely easily fixable cause of lung cancer in Canada. Preventative measures in new housing are very cost effective. The passive stack, for instance, is fairly cheap to install at new construction. And of course, in different parts of the country, not surprisingly, depending on the radon proneness of the area, you can get different cost effectiveness. And these cost utility analyses are a practical way of providing options to people for reducing the associated lung cancer burden in Canada. Kelly alluded to this federal building testing program that we worked on quite hard for a long time, and we just published a paper on it in the spring, and we compared about 7,600. So the federal government owns a lot of buildings. Some of them are residential, some of them are typical office buildings. So we looked at the cohort of office buildings, and we compared it to the data we got from our residential surveys. And as you can see there, the arithmetic mean for workplaces was basically less than half of that for homes. And our theory about the sort of massive difference, we only found about 2% of workplaces had radon concentrations above 200. The two main differences, I think, there is you generally have a much higher ventilation rate operating in office buildings, and larger buildings are generally built much better than homes. So there's a link to that paper, and it's open access, so anyone can actually read that paper if they're interested. And at this point, I will hand it over to my colleague, Grace, who will talk about a lot of the work that we're doing here at NRC. Grace?
Hello, good afternoon, everyone. Thanks for joining us during lunchtime and listening to us talking about radon. So what NRC has been doing on the radon topic since 2011 is really mainly focusing on the building science part of how to identify and, more importantly, quantitatively verify and evaluate different preventive or mitigation for like radon control measures in Canadian buildings. And the reason we're doing this, NRC is doing radon research really is to provide the much needed technical input to our fellow colleagues from Health Canada's health regulators, to our National Building Code colleagues as building regulators, and of course also to other provincial and municipal level of building regulators too. And also we're supporting the development of different national standards development and even international guidance documents on the radon topic. And we're hoping by evaluating those different radon solutions, we can provide the guidance or the technical inputs to builders and radon practitioners. And also we developed our in-house radon test facilities. So they're dedicated to radon diffusion and infiltration tests to challenge different building material and construction components to see how effectively they can prevent or reduce radon ingress into Canadian buildings. So we are, in that sense, we're supporting the emerging radon industry in Canada. And ultimately, of course, we would like to contribute, working alongside with Kelly and Jeff, to contribute to the public awareness of the radon issue, and more importantly, to demonstrate to the public, saying, you know, don't panic, radon is everywhere, but we have the solutions already verified, and they are not so difficult to be implemented. And how can NRC do the radon research? Of course, across the council, National Research Council, we have multidisciplinary expertise ranging from engineering to scientists and even different supporting teams for the infrastructure development. And also NRC has many unique facilities, including dedicated radon facilities, which I will elaborate a little more in the following slides. And also, within NRC, we also have another division. It's called the Canadian Construction Materials Center. And they do product evaluation and certification. And we as researchers, we work closely with our colleagues from CCMC. So we develop, we call technical guides for product evaluation. Then we conduct the testing. And the testing is to demonstrate whether a product or material meets the requirements of the current National Building Code. And if we can demonstrate it meets the requirements, then CCMC would issue the evaluation report and give them the CCMC number. So that's what they're going to use for them to, which would enable them to enter the Canadian market, obviously. And also, NRC is also the custodian of the National Building Model Code. So we work alongside with many of our colleagues from the standing committees for the National Building Code to address different building code change requests, which I will introduce a bit more in detail in the following slide. So speaking of National Building Codes, what are the requirements? Current National Building Codes, what are the requirements for radon prevention or soil gas control? So since 2010, that's when Jeff and many other colleagues work on the task group to introduce different soil gas control measures into the National Building Code. We can see in Part 9, which is for the housing and small buildings, we started requiring a gas permeable layer. Usually it's currently used as 3/4 gravel by most of the developers, of minimum depth of 4 inch to be under the air barrier system. So if any radon gas is building up, then can be collected and exhausted to outside of a building easily. And also we require air barrier system. The current minimum requirement is 6 mil poly membrane to be under the concrete slab, and the air barrier system should be continuous, should be overlapped and taped and sealed very well to all the joints and the penetrations and also concrete walls. And all the sump pit cover and the ground cover should be airtight. And more importantly, since 2010, the NBC Part 9 has been requiring radon roughing pipe, and this roughing pipe should be 4 inch in, minimum in diameter, and it's in the recommended material should be in PVC, and it should be sealed, capped, and labeled, and the bottom end should open close to or at the center of the slab, and the top end should be sealed and capped currently. But if the measurement after occupancy measurement showing the radon in the house is above the national guideline, then this radon wrapping can be activated by extending the pipe to outdoors, but more importantly, adding an inline radon control fan to translate into active soil depressurization system. And also in the Part 9 of the National Building Code, which is for the environmental separation, it recommended, to keep it very airtight or seal any potential radon entry points. It was set as the performance target, and also in the Part 9 of the National Building Code, in the heating, ventilation, and air conditioning part, it was recommended, actually referenced to the EPA guidance documents and recommended good HVAC engineering practice, including increasing the ventilation rate and also active soil depressurization for radon control. So based on those requirements in the National Building Code, all the research projects we have been conducting is around those topics. And the first one is the ASD system, which stands for Active Soil Depressurization. As both Kelly and Jeff mentioned, this system is most commonly used technique to mitigate radon. It was very well understood. This system would usually reduce the indoor radon level by 90% or more. However, in the Canadian context, the harsh winter weather creates certain challenges, or made this system in Canada look much different from the system in the United States. For example, the radon control fan in most Canadian homes for the ASD system is located in the basement. However, prior to 2014, before we developed the first national standard for CGAC for radon control in existing homes, there was no previous testing to verify whether there is a leakage through the radon control fan enclosure or not. So we actually, in our at NRC test house, and we developed our own test rig to verify whether there's the most commonly used radon control fan in the market, whether they're leaking to the indoors or not. And also, the ASD system can sometimes, currently can be a passive system. And the passive system meaning the discharge is no longer located in the basement just above the ground level. It can extend to upwards and passing through the unheated attic space. And for such a system, what is the requirement for insulation? Because during the winter, the attic temperature can be very low, almost the same to outdoor temperature. And within the radon stack, the soil gas moisture, based on our experience from years of monitoring and measurement, the relative humidity is 80% to 100%. So you can imagine during the winter, we're going to get a lot of condensation and ice buildup within the radon stack. So what's the insulation requirement for such system to prevent, to prevent the situation where the radon stack exhaust is completely blocked by ice? And also, there are many people questioning, when you have an active soil depressurization system in the house, when it's continuously operating, what does it do to our energy consumption, especially during the heating season, during cold winter? And also, you have a fan constantly withdrawing air from the subslab area. Would it create too much draft and lower the temperature around the footing and the exterior wall, or the soil temperature around the house? So in this facility, it's called Cleaning Center for Housing Technology, which features twin houses that we can evaluate the different building technologies side-by-side assessment. So in this house, we actually did quite a few years of monitoring with ASD system running in one house and keep the other house unchanged. So we did measure, by running an ASD system continuously, probably would increase the heating energy consumption by 5%, and it has a very marginal, insignificant impact on the soil temperature profile. And also, as mentioned, as Jeff and Kelly both mentioned, there's another way to prevent radon entry, especially from a building code perspective, is radon or air barrier system. So since 2014, NRC actually developed North America's first radon diffusion test chamber. And this test chamber is developed to the requirements of the ISO standard 11665 to test the radon diffusion in different building materials. So since development, we actually have tested a variety of material, including different concrete systems, different concrete products, different membrane products, different spray foam products, even rigid insulation foam boards. The reason we're doing those testing is we receive the request from the industry, but more importantly, Canada is currently moving towards net zero energy ready model code, which means subslab insulation we will not wait for much longer to have that in place. So this, if one material can, be functioning as insulation material, but also as a radon air barrier, then it's one stone for several birds. And I would like to mention, previously I mentioned that we work very closely with the Canadian Construction Materials Center. So in 2017, we actually developed quite a few technical guides, but here I just give one example. It's the technical guide we tested for the evaluation of spray foam product for radon prevention, and the product passed this evaluation already in the market. And also I would like to mention within NRC, we have another group developed a low-cost, direct reading, continuous radon monitor. It was with advanced electronics in the photonics group. And currently that monitor, the prototype, is actually being tested in our radon chamber for benchmark, so we can compare the readings between that monitor and the many other more sophisticated radon monitors we use for the diffusion test. And the previous radon diffusion chamber is a small chamber benchtop test, but we also developed this unique test facility called radon infiltration building envelope test system. So this one is basically a mock-up house of 6 feet by 6 feet footprint. This house, the difference between this one and the radon diffusion chamber is in this mock-up house, we usually install a different material or product within the floor assembly following the instruction manual provided by the industry or by the manufacturer. And so we call this is not only for material testing, but it's for the whole product evaluation. So this facility has been used very extensively to support the CCMC different product evaluation as well. And moving on to, so what have we observed from those radon dedicated test facilities so far? As I mentioned, the minimum requirement in the current National Building Code as radon barrier or as air barrier is 6 mil poly. So can 6 mil poly really effectively reduce radon ingress into the Canadian homes? So here is a plot. What I want to say is the horizontal axis is basically the ratio between, you can imagine the radon diffusion chamber with those very high concentration of radon into the dosing chamber, and the membrane or the material will be separating the dosing chamber and the receiving chamber. So you can imagine if the dosing chamber is your subfloor or your soil underneath your house, and the receiving chamber will be your house. So what a radon barrier, a good radon barrier really can do is to prevent all the radon or reduce the radon ingress from the subfloor area into your living space. So we consider the radon concentration of receiving chamber divided by dosing chamber, the lower the better. And then on the vertical axial is what we call the radon resistance of the different material. You can see the 6 mil poly is the point far to the left, and it has a more than 10%, actually it's about 11% of receiving radon concentration divided by the dosing radon concentration. And this ratio is about 7% for 10 mil poly. And if it's 20 mil poly, the percentage is 3%, meaning if you have 1,000 in the subfloor area, you would only get 30 in the living space, provided if this membrane is very well sealed and it's very well taped to all the penetrating points. Again, so when we test different products, we try to test in combination with the proper sealant or the tape or whatever sealing mechanism they would like to use. So over the years, we've been working with very closely with many industry clients. I don't want to get into all those details, but those are the companies we actually did product evaluation, and their products are now in the market for different purposes. Some are membranes, some are radon fans, and some are subslab ventilation panels. All contribute to radon prevention and control. And here comes another topic, which is actually in recent years pretty hot topic. It's about passive radon stack. In the British Columbia Provincial Building Code, it's called radon rafting pipe. So since 2014, British Columbia actually became the first province who mandated the installation of full height radon vent pipe, which extends through and terminates outside the building in its so-called radon area 1, which is the higher radon risk area. And from this little plot, you can see area 1 is actually the majority of the British Columbia, which was more the inland, the area excluding the coastal area. Since 2015, we as National Research Council, we have received several National Building Code change requests to include such a system into the National Building Code Part 9 in the National Building Code. So passive radon stack, as Kelly and Jeff both mentioned, especially Jeff mentioned, this is about 50% effective in terms of radon reduction. But also previous research has demonstrated probably in the colder climates, which Canada is within, this passive radon stack, because it's essentially using a chimney effect to withdraw soil gas, and this system can be more efficient in the colder climate. However, colder climates can introduce other complications. For example, as I mentioned previously, condensation development, ice buildup, and even some other complications to the design and operation of such a system. Therefore, after we received those building code change requests, NRC decided to do, full height passive radon stack field studies. Of course, we want to do this study to verify the actual performance of this system in Canadian homes and over long-term testing period. And also, of course, we do this testing. This study is to support the National Building Code Standing Committee to address the building code change request. And prior to the field study, we did do a few years of lab study in NRC's research houses. And we already figured out what's the insulation requirement, what are the pipe routing, what's the impact on the pressure loss, the stack height and the stack length in the attic, and also what kind of measurements we should be, measurement parameters we should include into the field study plan. So in 2017 to 18, we did 4 homes in the National Capital Region first, And then starting from 2018, we started doing more studies in British Columbia and also in Ontario. So in I'm only going to focus on 2018 to 2019. We did 2 homes, retrofitted homes in Ottawa, Ontario, and also we did 15 new homes in British Columbia, Prince George area. And we picked those 15 homes in Prince George is because those homes are all built after 2014 December, so they already have the passive stack in place when we started testing. And in all those houses, we actually kept the stack open for 30 days, and then we closed it for 30 days. We reopened for 30 days, and we closed again for 30 days. And this testing period was chosen with the hope is every 30 days testing period would give us would be long enough for us to minimize the interference from many other variations in terms of the occupants' behavior, in terms of weather conditions and the natural radon concentration variation, etc. And also we're measuring the indoor radon level, we're measuring the subslab pressure, we're measuring the different temperature and RH within the stack, and also the flow rate and the speed within the stack. And here, before we did, in the Ottawa area, before we did any stack installation, because I mentioned those are retrofitting homes, and we actually did something first, is we did a blow door test in all those homes, and while we were doing those blow door tests, we actually used the smoke pencil to go along the perimeter of the basement or any penetrating points crossing the basement concrete slab, try to locate different soil gas entry points, and we asked the contractor to seal those points or change the drainage valve, try to minimize the soil gas ingress passing points. And also I included 2 radon concentration plots into in this slide. As you can see, it's very clearly, those slides can demonstrate what the blue or greenish color is the radon concentration where the stack were open, and the other parts were stack were closed. And also the pink plots of radon concentration is in all the homes. After our 4-month testing period, we actually kept radon monitor there to continuously monitor the radon concentration for another year, just to give us to see the long-term radon reduction effectiveness. But you can see clearly, you can have a bad radon day, you can have a good radon day. In summary, the radon concentration varies over a very wide range and very rapidly. So in all the 17 homes we tested last year, it's very clearly to us when the passive radon stack was open, all the homes had radon concentration below the 200. So the passive stack was actually, especially for the homes naturally have radon concentration above 200, the radon reduction effectiveness associated with the passive radon stack was very, very obvious. And quite often, we notice the passive radon stacks. So of course, I won't we're not get into all the details of what would impact the passive radon stack in Canadian homes, but we can clearly see the length of the stack. The length of the stack in the attic, especially the distance between the stack and the exterior wall. Whether you have a bathroom, a bathtub on the ground floor, or whether you have HRV, HRV stands for heat recovery ventilator in your home. Those other factors would actually significantly affect the effectiveness of passive stack for radon control. So another radon control mechanism or method quite often people would like to know more about is about heat and energy recovery ventilator. So we actually started since 2 years ago to do a field study of HRV or ERV for radon control. In those homes, we would monitor radon, but also set the operating status of the HRV to different modes. For example, if you take a look at the 2 plots on your left side in this home, it has 2 HRV units. So we would be operating HRV, 2 HRV units, and then we measure the air changes per hour in this house. Then we operate 1 HRV and measure the air changes per hour as well. And then turn both HRV off and measure the air changes per hour. And then in the meantime, we will be monitoring radon concentration in the same house. So in this house, we noticed, we observed when we have both HRV on over 18 hours, the radon concentration increased to over 200 becquerels per cubic meter. However, after we turn both HRV on, within 4 hours, the radon concentration dropped from above 200 to about 33 becquerels per cubic meter, which was very, very effective. However, in the house on the right-hand side, this house, we kept the HRV or the ERV off, and then we measure the air changes per hour, and then we turn the ERV on, and 20 minutes for every 60 minutes, we measure the air changes per hour, and then we turn the ERV on full speed and measure the air changes per hour. And you can see the blue portion of the plots of radon concentration is when the ERV was turned on 20 minutes per 60 minutes, and the radon concentration is around 500 becquerels. And when the ERV was working full time, the radon concentration was still above 200. However, when you turn the HRV off, the radon concentration was above 800. So which demonstrates HRV and the ERV can be used for radon control, but it's more suitable for houses that are naturally very airtight with only moderate radon levels. So here is just a table summarizing different methods we use to control radon in the Canadian context. So typically, as active subslab depressurization would reduce indoor radon level by 90% or more, and it costs typically $3,000 for a retrofit. And as just mentioned, in new construction, this number can be $1,600 to $1,800. And also, this system can actually help to reduce the moisture in the basement as well. A passive radon stack typically in Canadian context can have 40 to 90% radon reduction rate. And in the new construction, we can typically see it's about $800. And of course, for retrofit, it can be way more expensive. But if it's installed during the new construction phase, it will be very easy to install. And the improved radon barriers, the cost may vary and the effectiveness may vary, but we don't recommend it as a standalone radon control measure that will be combined with other measures. And HRV, ERV, the balance and the maintenance of HRV, ERV can be tricky. And the HRV, ERV for radon control is about a 50% reduction, and it costs about $3,000 for this system. And we know in the future, Canada is moving towards net zero energy ready. So HRV, ERV will be, not surprisingly, probably most of the new build. So HRV, ERV can also be used to control to solve many other indoor air quality related problems. So I'll pass it to Jeff again.
So I'm just going to rip through these last couple of slides. One thing we like to make an analogy occasionally is between carbon monoxide and radon, and they're both actually known as the silent killer. I particularly like carbon monoxide to be known as the silent assassin because it tends to kill you very quickly. Conversely, although radon risk takes a long time to develop lung cancer, unfortunately it's diagnosed too late, and the fatality rate is still about 85%. So it's not a very happy diagnosis when you get hit with a lung cancer diagnosis. And we found that the current testing rate in Canada is around 6%, and when we did our follow-up study, we found only about 29% of people mitigated, which is consistent with many other countries. So it's still hard to get people to motivate people. These are just, I've put on in passing. We've recently modified and updated our testing guides for buildings and homes, and they're available for free for download from the Health Canada website. Similarly, these two new radon standards with the CGSB, because the CGSB is a part of the Government of Canada, those two national standards are available for free for download. And as we alluded to earlier, we're starting to get involved in some International Atomic Energy Agency work, and this guide was just published in the fall, and it may be of interest for people if they're interested in doing radon surveys out as a stakeholder on the line. And we're also working with the IAA currently on 3 other radon guidance documents.
Oh, so I'll talk a little bit more about NRC, but I'm going to NRC future work, 2019, 2020, and beyond. One of the most important thing is the task group for the past radon stack building code change request. The meeting will take place very soon. I believe it's next month. Oh, next week. So, and also we're hoping we can build more and more data, the database of building materials and products for radon control. And we will be, as of 2020, this year, we're doing the past radon stack field study in 22 more homes in, Manitoba, in Quebec, in Ontario, and in British Columbia. And we are currently recruiting in more homes to join the HRV, ERV field study for indoor radon control. And as I mentioned, we are hoping the net zero energy ready building code will introduce more change to the Canadian building stock. So we want to do more radon and also indoor air quality related study in their buildings. And we are continuously working to support the different national standards development. For example, the F300, the building depressurization, F326, the mechanical ventilation system in residential buildings, and so on. So those are the couple of things, and both Jeff and I were working for, as Jeff mentioned, for the International Atomic Energy Agency to develop different safety guidance documents to in relation to radon and building materials. So
that's our slide deck. It was very ambitious, and I hope you got some interesting stuff out of it. And I know we ran a little late, so we'll take questions, I guess, at this point.
We have a question from Martha for Kelly. What data source informs the radon map? Only data collected by Health Canada?
Yes, at this time we're using only our data from the 2 large-scale cross-Canada surveys that we've done.
We have a question from WDGPH. Why radon levels are different for Canada and U.S. 200 becquerels per meter cubed and 148 becquerels per meter cubed? Any studies that support 200 becquerels per meter cubed?
So this is Kelly. I can speak to that. We often get the question why the difference in the guideline level between ourselves and the U.S. and also with the guidance from the World Health Organization recommending 100 becquerels per cubic meter. So Health Canada continues to review and consider changing the guideline level. At this point in time, we've decided to keep our guideline level at 200. With regards to the difference, the actual difference between ours and the U.S. is quite small. What I think for us is really important is that how you communicate the risk around radon. At 199, you're not safe. And we make sure it's clear in our communication, in our materials, et cetera, that there is no safe level of radon, that ultimately it's guidance, it's a guideline level, but ultimately it's up to each individual to determine their tolerance for risk.
I think that's all the questions we have in the chat box right now. I'd like to thank everyone who joined us today for the CIPHI Ontario Seminar Series. It was great to have such great participation online. I would like to thank Jeff White, Dr. Leanne Grace Zhao, and Kelly Bush for presenting today. And I'd ask everybody please complete the evaluation that will be sent in your inbox. Also like to reflect on how you can take this information and use it in your work, in your day-to-day setting. Thank you everyone for joining us today.
Thanks for having us.
Thank you.